Dr. Ronald Lett. We're on lesson 4 of our series on minor surgery. We will be doing laceration repair and minor procedures soon. But just before we get there, we need to know what do you need to do those procedures. Here we have a laceration. We need something to prepare the skin. We need a sponge forceps with a sponge. We need local anesthesia, a guarded needle with a syringe, and a sharp container. In addition to that, we need a fenestrated drape. So let's go through the procedure. You put some antiseptic solution on your sponge, and you make a circular preparation starting at the wound and moving outwards. Once you're satisfied with that, you would then put a drape on this. This is called a fenestrated drape. It has a hole in it. So there we have a sterile field. Your local anesthesia can be in a bottle that is sterile, or it can be off field and an assistant can hold it for you. Here we're assuming it's sterile. We take the syringe needle, expose it. We inject air into the local anesthesia. We aspirate out the local anesthesia. We now infiltrate the skin. This is a laceration. We just go through the laceration itself. As you do this, it will swell a bit where the fluid of the local anesthesia goes in. Make sure you do the entire wound, and you go to the two ends. You now have prepared the skin, created a sterile field, provided local anesthesia, and then you put the guard over the needle and you dispose of it in a sharp container. This is what you do for lacerations and minor procedures every time. You have prepared the skin. You've put a drape on it. You've applied the local anesthetic. Now you need to close the lacerations. We're going to look at 4 types of laceration repair: simple suture, vertical mattress suture, horizontal mattress suture, and intradermal. So here we have the CNIS laceration board. We have a needle holder. I have some undyed suture, which is used because it appears more visible on the video. This is a 2-0 cutting needle. You wouldn't want to use anything bigger than this. I would often use 3-0 or 4-0. If it was on the face, I might even use 5-0 suture. So here we have our suture. I've placed the needle within the needle holder at the 2/3, 1/3 junction. Laceration repair. Here we have a laceration. We go through the dermis and epidermis. Again, the opposite side. The entry wound and the exit wound of your needle should be equal distance from the edge of the laceration. We're going to use the instrument tie that you learned earlier. Double throw on the first. When you practice, don't just do one. Entirely close your laceration. I should have had a suture scissor, but even if you don't, you can use your scalpel for that. So there is a simple suture to close the entire laceration through the epidermis, through the dermis, equidistant from the laceration. Wrap it twice, stay within the V. When you're doing lacerations, you want the skin edges together. But we have an expression in surgery: oppose, don't necrose. You don't need it super tight. You have to depend on the human body to do the healing, but you need to have them together. So this laceration needs one more suture. There's a bit of a gap there because the patient lost some tissue in their laceration. So that is going to have to be healed by the epidermis growing together. So there is your simple suture. 3 simple sutures. Now, we're going to go to the next type. It's called vertical mattress. You have an exit and an entry wound a little bit farther away from the laceration than in simple suture. So I'm going underneath the dermis and up through the epidermis. Right now it looks a bit like a simple suture, but now you reverse. You pick up the skin edge right at the edge of the wound, and you do it again on the other side. So the vertical mattress, far, far, near, near. This helps bring the skin edges together when they are not wanting to do so naturally. The result of a mattress suture is that you have suture lying on the skin, as you can see, from the far suture to the near suture, from the near suture to the far suture. That will create cross hatches in the skin. So cosmetically, it's not as nice as the simple suture, but it's important to have the skin edges together. So we're going to put one more vertical mattress in. You can see the dermis and the epidermis. Want to get just enough purchase so it'll hold, but not so much that it's far away. There we have simple suture, vertical mattress suture. The patients don't always understand what you want them to do. They don't come in with lacerations that are convenient. Here is a torn laceration. And I'm going to think that a horizontal mattress would be good. With this tear, with this end here, this end is at risk of dying because the blood supply is going to be less because it has to all come in from this side. So I'm going to use horizontal mattress. So what's horizontal mattress? I come through the epidermis and dermis on one side. Good to do it again. So again, it looks like a simple suture right now. But now, I'm going to move my suture down. It's almost like two simple sutures. I'm going to come out through the laceration here. And you can see, unlike the vertical mattress, the suture is lying parallel to the wound. And when you do that, it brings the skin edges together. Now I'm running out of suture, so let me get another suture. I've got some furrow here. So I'm going to complete this torn laceration with the furrow. It's finer suture. So what am I going to do with this end? It's a horizontal suture, but a little bit of a variation. I'm coming through the epidermis and dermis. I'm now going to grab just the dermis, the white tissue below the epidermis. And then I'm going to come out on the other side through the dermis and epidermis. This way it will pull the corner of that laceration together. See how it lifts up? When it lifts up, that will mean that it will heal. So horizontal is good to bring the edges of skin together, and it's also very good when you have ragged wounds. The final type of suturing we're going to learn is intradermal. Some people call it subcuticular. Here we have a laceration. I'm going to just bring the exit wound above the wound. So the intradermal has the advantage of not going through the epidermis. You just grasp that white tissue below the dermis. So you're suturing dermis to dermis. This is good in children because if you use an absorbable suture, you don't have to remove it later. The dermis is made of collagen, which is quite strong. So it's actually quite a strong suture. You have to be careful not to go through the epidermis. Trouble with the 4.0 is the needle's very small. Makes it nice cosmetically, but more fiddly to put it in. And it's twisting in my needle holder. See how I've got a nice grasp of dermis there. And then I'll just come out through the end. Now there's many ways of managing the end. You can put a knot on it. With a loop. You can bury the knot. You can put a steri strip on it. Because it's strong enough, it won't move. Never leave a loop, it'll catch on something and get pulled out. So you've learned 4 types of suturing for laceration repair. This is all you really need to know. Simple suture, vertical mattress, horizontal mattress, particularly useful for jagged cuts, and intradermal.
Thank you for watching, and please follow us on Facebook, Twitter, Instagram, and be sure to subscribe and like us on YouTube. If you would like more information about CNIS or on how to become our member, please go to www.cnis.ca.